probably heard of COVID-19 or coronavirus disease, discovered in 2019 and responsible for global endemic. COVID-19 is caused by SARS-CoV-2 or Severe Acute Respiratory Syndrome coronavirus 2 because it's genetically similar to SARS coronavirus and which is responsible for SARS outbreak in 2002. Coronaviruses circulate among bats, which is also responsible or natural reservoir of coronavirus. From bats, the virus transmitted into the penguins by changing their strains. And in late 2019, it spreads into the humans by the penguins. And within 3 months of spreading in humans, there are 1 lakh 10,000 confirmed clinical diagnosed cases of COVID-19 and 3,800 deaths with the fatality rate 3.5%. And in starting of China, January 1 to 10, it's about 16% fatality rate, and it decreased in February with 0.8%. Based on the current cases, 80% of the cases of COVID-19 having mild infections or less symptoms, or some don't develop any symptoms, or other can develop symptoms like fever, cough, dyspnea, shortness of breathness, or some complications like pneumonia. Severe lung disease or damage caused ARDS, acute respiratory distress syndrome, that cause accumulation of fluids within the alveoli, and it can cause septic shocks, septic infections. Due to this, oxygen saturation starting to decrease, and this is the main cause of death in COVID-19. And some people are more risk for COVID-19 like older age more than 16s, smokers, previous medical conditions like tuberculosis, diabetes, HIV. In these patients, coronavirus can spread quickly. The virus is spread by coughing or sneezing, or also called droplet infections. The virus enters in the body by the nose, mouth, eyes. When the infected case of COVID-19 goes to non-infected area, it's called imported case. When the number of the people's contact with the source of infections is called community transmission. To prevent community medicines, some schools, businesses are shut down, conferences and sports activities are postponed or cancelled. Once the person is infected, symptoms develops 5 days later. It's called incubation period. And there are many patients who are asymptomatic or pre-symptomatic people spreading diseases. Viruses are reproduce themselves very quickly, represented as R naught, means how quickly it spreads, or R naught 1 means the infected person passes to one new case, or R naught 2 means one person spreads to two new persons, and so on. If R naught is below 1, infection period is out. If R naught is 1, the infection is steady or stay steady. And now COVID-19 is R naught 2.2. That means it spreading quickly. Or R naught of flu viruses are 1.3. That means it is spreading more rapidly than flu viruses. To confirm the diagnosis of COVID 19, reverse transcriptase are done, RT-PCR test, which can detect very small amount of viral DNA or RNA. If the disease is very spreading very quickly or rapidly, chest CT can be done to detect a viral pneumonia or other complications, and also look for other causes like quick flu test or respiratory viral panel. Treatment is the supportive care like fluids, oxygen, ventilatory supports, and other flu drugs like remdesivir, which is tested on large scale clinical trials in China. Unfortunately, there is no vaccine to protect coronavirus. There is one vaccine in clinical trials and it can be prepared by 2021 approximately. Avoid person to person transmissions, person to person contact. In areas with community transmissions, anyone with mild symptoms of COVID 19 should wear a mask whether they are diagnosed with COVID 19 or not. And they should self quarantine in home. If the symptoms are worse, call the clinics and talk to your clinicians or doctors. And the person who is suspected for the COVID 19 should self quarantine in separate room, use separate bathroom, avoid sharing household items, and there are many cases were confirmed with dogs. Human to dog transmission are confirmed in many cases, but there is no confirmation in dog's dung of COVID 19. And finally, with symptoms of COVID 19, the person should not attend any schools, work, or person gatherings, avoid any travels. Coronavirus is usually not spread in long distance in air, but it can transmitted through coughing or sneezing in one person to another and can survive on surface for over a day. Healthy persons in non-outbreak area avoid travel to disease outbreak areas, stay away from crowded places, stay at least 6 feet or 2 meters away from someone with symptoms. Surgical mask not recommended for normal persons, it recommended for healthcare persons. Cleaning and sterilize surfaces continuously like doorbells, handles, and always careful hand washing is key. It should be done with say alcohol, soap, and sanitizers. Also avoid touching T-zone. T-zone is the eyes, nose, and mouth. It is the also common entry point of the viruses into the body. For healthcare workers, droplet and contact precautions should be taken. Wear a surgical mask, gloves, long-sleeved gowns, and eye protection. In procedures like produce aerosols, CPRs, and 95 respirators should be wear. It prevent 95% of small droplets from entering into the body.